Welcome back YouTubers to An Everyday Life on Aspie. If you're new, I'm Aspie. I'm all about creating mental health and awareness and sharing my life stories with Asperger's syndrome and the like, along with tips and advice along the way, as well as in saying there's also some fun and games. If you're into any of these and more, feel free to subscribe on the bottom right hand corner of the screen, and once you do so, feel free to turn on the notification bell so you don't miss any future updates or future videos like these and more to come. So as you'll know, basically it is a given that many people obviously tend to use drugs for their own gain or their own purposes, be it if it's just want to use it for recreational use versus just the medicinal use, regardless what it may be. So as you know, that I am talking about the different drug types of the common ones or the popular ones that are actually used in our everyday life regardless what they are. And in saying this one's obviously all about the anabolic and androgenic steroids. If you're into any of these, smash the like, feel free to comment below, feel free to also let me know if you've used any of these type drugs and how did you feel about them. A message to the viewers that are watching today to let us know what you want to share based on a form of encouragement or just maybe in a form of just telling us your story, how you actually became drug free from that. For goodness. Basically, anabolic steroids are also known more properly as anabolic androgenic steroids that are steroidal androgens that includes natural androgens like testosterone as well as synthetic androgens that are structurally related and have similar effects to testosterone. They are anabolic and increases the protein within the cells, especially skeletal muscles, and also have varying degrees of androgenic and virilizing effects, including induction of the development and maintenance of masculine secondary sexual characteristics such as the facial growth hair and body hair. The word anabolic, referring to anabolism, comes from the Greek word anabole, which is thrown up mound. Androgens, or AAS, are one of the three types of sex hormones agonists, the others being estrogens like estradiol and progesterones for the female. AAS was synthesized in the 1930s, however, and are now used therapeutically in medicine to stimulate muscle growth and appetite, induce male puberty, and treat chronic wasting conditions such as cancer and AIDS. The uses for this are your medical, various AAS and related compounds. Since the discovery and synthesis of testosterone in the 1930s, AAS has been used by physicians for many purposes with varying degrees of success. These can broadly be grouped into anabolic, androgenic, and many other uses. So the first one is your anabolic. Bone marrow stimulation. For decades, AAS were the mainstay of therapy for hypoplastic anemias due to leukemia or kidney failure, especially aplastic anemia. Growth stimulation. AAS can be used by pediatric endocrinologists to treat children with growth failure. However, the availability of synthetic growth hormone, which has fewer side effects, makes this as a secondary treatment. Stimulation of appetite and preservation and increase of muscle mass. AAS has been given people to chronic wasting conditions such as cancer and AIDS. Stimulation of lean body mass and prevention of bone loss in elderly men, as some studies has indicated. However, a 2006 research placebo-controlled trial of low-dose testosterone supplementation in elderly men with low levels of testosterone found no benefit on body composition, prevention, or treatment of osteoporosis in postmenopausal women. However, nandrolone decanate is approved for this use. Although they have been indicated for this indication, AAS saw very little use for this purpose due to their visualizing effect. The American College of Sports Medicine acknowledges that AAS, in the presence of adequate diets, can contribute to increases in body weight, often as a lean mass increase, and that gains in muscular strength, achieved through high intensity exercise and proper diet for some individuals based on the use of AAS. Health risks can be produced by long-term use or excessive doses of AAS, however. These effects may include the harmful changes in cholesterol levels, increased low-density lipoprotein, and decreased high density of lipoprotein, acne, high blood pressure, liver damage, mainly with most oral AAS, and dangerous changes in the structure of the left ventricle of the heart. Conditions pertaining to hormonal imbalances such as gynecomastia and testicular size reduction may also be caused by AAS. In women and children, AAS can cause irreversible masculinization. Ergogenic uses for AAS in sports, however, racing and bodybuilding as performance-enhancing drugs are controversial, however, because of their adverse effect and the potential to gain unfair advantage in physical competitions. Their use is referred to as doping and banned by most major competitions or sporting bodies. For many years, AAS has been by far the most detected doping substances. In some countries where AAS are controlled substances, there is often a black market in which is smuggled. Side effects: aiding weight gain following surgery or physical trauma, however, during chronic infection or in the context of unexplained weight loss, counteracting the catabolic effect of long-term corticosteroid therapy. Oxygen improves both short-term and long-term outcomes in people recovering from severe burns, as well as establish a safe treatment for this indication. Treatment of idiopathic short stature, hereditary angioedema, alcoholic hepatitis, and hypogonadism. Methyl testosterone is used in the treatment of delayed puberty, hypogonadism, cryptorchidism, and erectile dysfunction in males, and in low doses to treat menopausal symptoms, specifically for osteoporosis, hot flushes, and to increase libido and energy, postpartum breast pain and engorgement, and breast cancer in women. Androgenic is the next one. Androgenic replacement therapy for men with low levels of testosterone, also effective in improving libido for elderly males. Induction of male puberty. Androgens are given to many boys distressed about extreme delay of puberty. Testosterone is now the only androgen used for this purpose, and has been shown to increase height, weight, and fat-free mass in boys with delayed puberty. Masculinizing hormone therapy for transgender men, however, on other masculine people and intersex people by producing masculine-like secondary sexual characteristics, such as a voice deepening, increased bone and muscle mass, masculine fat distribution, facial and body hair, and clitoral enlargement, as well as mental changes such as alleviation of gender dysphoria and increased sex drive. And then you've got under other, treatment of breast cancer in women, although they are now very rarely used for this purpose due to their marked virilizing side effects. In low doses is a component of hormone therapy for postmenopausal and transgender women, for instance, to increase energy, well-being, libido, and quality of life, as well as to reduce the hot flashes. Testosterone is usually used for this purpose, although methyl testosterone is also used. Male hormonal contraception, currently experimental at this point of time, but potential for use as effective, safe, reliable, and reversible for male contraceptives. The AAS has been used most commonly in medicine are testosterone and many esters, but most typically testosterone indicanates, testosterone ethanoate, testosterone cypionate, and testosterone propionate. Nandrolone esters, particularly nandrolone denote and nandrolone phenate, so on and so forth, are used. Some of these are used in veterinary medicine, however. A vial of injection of testosterone cypionate are the full common forms in which AAS are administered: oral pills, injectables, steroids, creams, gels for topical application, and skin patches. In the oral administration, however, this is the most convenient way to use. Testosterone is the most convenient. Testosterone administered by mouth is rapidly absorbed, however, but it is largely converted to inactive metabolites, and only about 1/6 is available in the active form. In order to be sufficiently active when given by mouth, testosterone derivatives are alkylated at about 17A position, for example, methyl testosterone and floxasterone. This modification reduces the liver's ability to break down these compounds before they reach the systemic circulation. Testosterone can be administered parenterally, but it has more irregular prolonged absorption time and greater activity in the muscle in anabolate, androgenic, or cypionate ester form. These derivatives are hydrolyzed to release free testosterone at the site of injection. Absorption rate of this injection schedule varies different S's, but medical injections are normally done anywhere between semi-weekly to once every 12 weeks. A more frequent schedule may be desirable in order to maintain a constant level of hormone in the system. Injectable steroids are typically administered into the muscle but not into the vein to avoid sudden changes in the amount of the drug in the bloodstream. In addition, because estered testosterone is developed in oil, intravenous injection has the potential to cause a dangerous embolism, a clot in the bloodstream. Transdermal patches. Adhesive patches placed on the skin may also be used to deliver a steady dose through the skin and into the bloodstream. Testosterone-containing creams and gels are applied daily, are also available, but absorption is efficient. Individuals who are especially physically active and will bathe often may not be the good candidates. Since the medication can be washed off and may take up to 6 hours to be fully absorbed. There is also a risk that an intimate partner or child may come into contact with the application site and inadvertently dose himself or herself. Children and women are highly sensitive to testosterone and can suffer unintended masculinization and health effects even from just the small doses. Injection is the most common method used by individuals administering AAS for non-medical purposes. The traditional routes of administration doesn't have differential effects on the efficacy of drug. However, studies indicate that the anabolic properties of AAS are relatively similar despite the differences in pharmacokinetic principles such as first-pass metabolism. However, the orally available forms of AAS may cause liver damage in high doses. Known possible side effects of AAS may include of the following: dermatological, intermental, which is your oily skin, acne, vulgaris, acne, conglobata, seborrhea, stretch marks due to rapid muscle enlargement, hypertrichosis, excessive body hair growth, androgenic alopecia, pattern hair loss, scalp baldness, florid intention, edema, libido changes, reversible infertility, hypogonadotropic hypogonadism, spontaneous erections, nocturnal emissions, priapism, erectile dysfunction, gynecomastia, mostly only with aromatazole and hence estrogenic AAS, testicular atrophy, intravascular lymphoma, prostate hypertrophy, prostate got masculinization, irreversible voice deepening, hirsutism, which is your excessive facial hair and body growth, menstrual disturbances, e.g. anovulation, oligomenorrhea, amenorrhea, dysmenorrhea, clitoral enlargement, hirsutism, excessive facial body growth and hair, premature epiphyseal closure and associated short stature, precocious puberty in boys, delayed puberty and contrasexual prosperity in girls, dysphoria, suicidality, delusions, psychosis, under the psychiatric, neurological, I'm reading, mood swings, irritability, aggression, violent behavior, impulsivity, recklessness, hypomania, mania, euphoria, depression, irritability, dependence, withdrawal, neurotoxicity, cognitive impairment, muscle hypertrophy, muscle strains, tendon rupture, rhabdomolar system, dyslipidemia, increased LDL levels, decreased HDL levels, reduced ApoA1 levels, cardiomyopathy, myocardial hypertrophy, elevated liver function test, AST, ALT, bilirubin, LDH, LELP, hepatotoxicity, jaundice, hepatic steatosis, hepatonemia, hepatocellular carcinoma, cholestasis, pulmonary hepatitis, all mostly or exclusively with 17A alkylated AAE, renal hypertrophy, nephropathy, acute renal failure, secondary to rhabdomyolysis, focal segmental glomerulonephritis, renal cell carcinoma, glucose intolerance, insulin resistance, immune dysfunction. Depending on the length of drug abuse that has been entailed, there is a chance that the immune system can be damaged. Most of these side effects are dose dependent, the most common being elevated blood pressure, especially in those with pre-existing hypertension. In addition to morphological changes of the heart, which may alter cardiovascular and irreversibility. AS has been shortened to alter fasting blood sugar and glucose tolerance level tests. AAS such as testosterone also increases the risk of cardiovascular disease or coronary artery disease in this matter. Acne is fairly common among AAS users, mostly due to stimulation of the sebaceous glands by increased testosterone levels. Conversion of testosterone to DHT can accelerate the rate of premature baldness for males genetically predisposed, but testosterone itself can produce baldness in females. A number of severe side effects can occur if adolescents use AAS. For example, AAS may prematurely stop the lengthening of bones, premature epiphyseal fusion through increased levels of estrogen metabolites, resulting in stunted growth. Other side effects can include alterations in the structure of the heart, such as enlargement or thickening of the left ventricle, which impairs its contraction and relaxation states, and therefore reducing ejected blood volume. Possible effects of these alterations in the heart are hypertension, cardiac arrhythmia, congestive heart failure, heart attacks, and sudden cardiac arrest or death. These changes are also seen in non-drug using athletes, but steroids may have accelerate this process, however. Both the connection between changes in the structure of the left ventricles and decreased cardiac function, as well as the connection to steroid use, have been disputed. AS can cause harmful changes in the cholesterol levels. Some steroids cause an increase in the ADL, bad cholesterol, and decrease in the HDL, good cholesterol levels. In addition, steroids provoke a rapid increase in body weight and accompanying rise in blood pressure, both of which leave use more vulnerable to cardiovascular events. AAS used in adolescents quickens by maturation and may reduce the adult in high doses. Low doses of AAS, however, such as oxygenolin, are used in the treatment of idiopathic short stature, but this may only quicken maturation rather than increasing adult masculinization. Female-specific side effects include in body hair, permanent deepening of the voice, enlarged clitoris, and temporary decreases in menstrual cycles. Alteration of fertility and ovarian cysts can also occur in females. When taken during pregnancy, AAS can affect fetal development by causing the development of male features in the female fetus and female features in the male fetus. Kidney tests revealed that 9 of the 10 steroid users develop a condition called focal segmental glomerulosclerosis, a type of scarring within the kidneys. The kidney damage in the bodybuilders has similarities to what is seen morbidly in obese patients, but appears to be even more severe problems. High doses of oral AAS compounds can cause liver damage. Pulmonosis, hepatitis has been increasingly recognized within the use of this. Mood and anxiety. Affective disorders have long been recognized as a complication of AA use. Case reports describe both hypomania and mania, along with irritability, elation, recklessness, racing thoughts and feelings of power, and invincibility that did not meet the criteria for mania, hypomania, however, of action. The human androgen receptor bound to testosterone, the protein is shown as a ribbon diagram in red and green, which I'm showing you right now. The blue is steroid, the steroid shown in white. The pharmacodynamics of AS are unlike peptide proteins. Water soluble peptide hormones can penetrate the fatty cell membrane and only indirectly affect the nucleus of target cells, though through the interaction with the cell's surface receptors. However, as fat-soluble hormones, AAS are membrane permeable and influence the nucleus of cells by direct action. The pharmacodynamic action of AAS begins with when the exogenous hormone penetrates the membrane of the target cell and binds to an androgenic receptor, or AR, located in the cytoplasm of the cell. From there on in, the compound hormone receptor diffuses into the nucleus, whether it either alters the expression of genes or activates the processes that sends the signals to other parts of the cell. Different types of AS bind to the AAR with different affinities depending on their chemical structure. Some AS, such as metadiene, bind weakly to this receptor in vitro, but still exhibit AR-mediated effects in vivo. The reason for this discrepancy is not known. As the name suggests, AS has two different but overlapping types of effects: anabolic, meaning the promote anabolism, cell growth, and androgenic, or virilizing, meaning that they affect development and maintenance of muscular characteristics. Some examples of the anabolic effects of these hormones are increased protein synthesis from amino acids, increased appetite, increased bone remodeling and growth, and stimulation of bone marrow, which increases the production of red blood cells. Through the number of mechanisms, AAS stimulate the formation of the cells. Effects: androgens, natural AS like testosterone and DHT, and synthetic AS mediate their effects by binding and activating the AR on the basis of animal biopsies. The effects of these agents has been divided into two partially dissociable types: anabolic, myotrophic, and androgenic. Body fluids. The most commonly employed human physiological specimen for detecting AS usage is in urine, although both blood and hair have been investigated for this purpose also. The AS, whether of endogenous or exogenous origin, are subjected to extensive hepatic biotransfusion by a variety of enzymatic pathways. The primary urinary metabolites may be detectable for up to 30 days after the last use, depending on the specific agent, dose, and route of administration. However, a number of the drugs have common metabolic pathways, and the excretion profiles may overlap of these endogenous steroids, making depression of testing results a very significant challenge to the analytical chemist. Methods of detection of the substances or the excretion products in urine specimen usually involve gas chromatography, mass spectrometry, or liquid chromatography mass spectrometry. Although anabolic steroids was originally intended to specifically describe testosterone-derived steroids with a marked association of anabolic and androgenic effects, it's applied today indiscriminately to all steroids with AR agonism-based anabolic effects, regardless of their androgenic potency, including even non-synthetic steroids like testosterone in itself. While many anabolic steroids have been diminished androgenic relative to anabolic potency, there is no anabolic steroid that's exclusively anabolic, and hence all anabolic steroids retain androgenicity. Likewise, all androgens are inherently anabolic. Instead, it's probably fundamentally impossible to completely dissociate anabolic and androgenic effects, as both types of effects are mediated by the same signaling receptor of the AR. As such, the distinction between the terms anabolic steroid and androgen is questionable, and this is the basis for the revised and more recent term anabolic androgenic steroid, AAS. So this quickly ends based on the anabolic steroids. Hope you learned something. Smash a like if you did. Comment below. Feel free to share these videos around. Follow me on my social medias. Feel free to also, as I said before, I have a website going right now with my merch, and if you get 15% off, you got only 2 or 3 more days, I think, from memory to do it. So check it out. The link will be in the description below, as well as maybe on the screen for you guys to follow. And all further ado, guys, thanks for support, thanks for watching. Do what love what you do. Until next time, Aspie signing out, and I'll see you again soon.